So your lack of D could be causing your calcium deficiency. If you don't have enough D3, it's going to affect your calcium absorption, which means your bones don't have a chance. Not having enough D affects your calcium absorption. So you need D just as much as you think you need calcium for healthy bones. So what should your D levels actually be? Because when you look at your blood work, you might not be optimal. Remember, your blood work will show ranges that are not necessarily optimal, just enough to not be horrid. So your D levels should probably be 50 to 70. If you're in the low to mid 40s, that's not good enough. Now, the principal way that you get vitamin D is, in theory, through your skin synthesis, cutaneous synthesis, but you're not getting enough D, okay? You're just not. And the further north you go into colder lands, like let's say Canada, everybody should be taking D. Everyone, every single one. So wild caught fish can have D. Farm-raised fish do not have the amount of sexy D that you need. You know how grandmothers would make you take cod liver oil? That's why. The cod liver oil, the fish oil, it's the D. The reason they had you take cod liver oil was to ward off rickets. Yeah. Then the US started fortifying milk with D. They presumed people were getting your D there, and I kind of think that people dropped off the cod liver oil wagon. Now we have D added to orange juice, but I sincerely think supplementation and measuring your blood work, your serum D levels is your best way to go, because it's something you could truly take, then measure. Take, then measure. It matters. And D3 is much more effective for treating a D deficiency than D2. So that's why I say D3. If you want to know what D I personally use, you can click the link in my bio and check my Amazon storefront. These are things I actually take and my patients take as well. But fun fact, do not take your D with your coffee in the morning. Please don't. It doesn't jive as well with that, okay? And your D3 needs to have K2, because D3 and K2 are like best friends, and both of them tell each other where to go, and then it drives calcium into your bone. And if you're going to do this, let's do this. Let's do this to fix all of you. And low serum vitamin D, so that is when you measure your blood work, it's associated with low calcium levels. Remember, your teeth are also bones. So if you're having issues with dental, you might also want to think about D. Hit the plus sign and follow for more women's health and wellness tips. Bye.